Hi everybody, it's Dr. Newman, board certified plastic surgeon in New York. I want to talk a little bit about mommy makeovers, what they are. It's very much a marketing term, so I'm not loving that terminology. But in general, what a mommy makeover is that during pregnancy, stuff happens to the body. And we get focused on what it's doing to the breasts and what it's doing to your midsection, or your abdomen. And it's not always predictable. What happens to the breasts is not always the same thing from patient to patient. What happens to the belly is not always the same thing from patient to patient, and we don't treat every patient that comes in after pregnancy the same way. There are some patients who I will treat their breasts and treat their belly at a separate time. There are some patients where we'll do them together. When it comes to the treatment of the breast, it really depends upon what the problem is with the breast, because it's not the same for everybody. Many patients will nurse, many patients will not nurse, and that also doesn't seem to become something that's predictable as far as what it's going to do to the resulting size and shape of the breasts. But when we're dealing with the breasts after pregnancy, very frequently we're dealing with a change in volume from before pregnancy. Some patients feel their breasts got much larger, some patients feel their breasts got much smaller, and many patients feel that their breasts got much lower. Frequently, when patients lose volume in their breasts will appear not just low, but patients come in using the term empty. They'll feel like their breasts feel and look empty. And frequently what they mean is that they've really lost any fullness towards the top of their breast and everything is really much lower. There are many cases where patients need to have a breast lift, but frequently we'll do a breast lift and put an implant in to at least replace the volume that people may have lost since pregnancy. And many patients really want to be even larger than that because it may give them a little bit more fullness towards the top of their breast. To me, that whole concept of making people huge, which was something that was common years ago, is not something that in my practice I really focus on. But for many patients do want to increase their volume after pregnancy when their breasts feel very empty. So frequently we will put an implant in at the same time as doing a breast lift, and there's different ways to do that, but frequently that's what we'll do for the breast. There are many patients who feel like their breasts have gotten much larger and still that their breasts have gotten lower. These are patients who might not necessarily need more volume. These are patients who may very well need less volume, so we may do a breast reduction with a breast lift. But what's done for the breast really depends upon what happens to the breasts over time with pregnancy. And again, it's not all that predictable. When it comes to the belly for a mommy makeover or after pregnancy, again, it depends upon patients. Many patients, just as we see with patients who have large weight loss, many patients end up with very loose skin in their abdomen. Sometimes people end up with a belly that looks as good as it did before pregnancy. It's, again, not all that predictable. But what seems to be common is that the muscles do separate during pregnancy, and that's something that may or may not be something that needs to be addressed for patients. Sometimes patients just have a little bit more fat in their lower belly, but the quality of their skin is still fine. And some patients have a belly that's just full of stretch marks. And for those patients, no matter what you do, that skin is not going to tighten without physically removing some of that skin. So there are patients that you can treat simply with liposuction. Sometimes I'll add skin tightening using Renuvion in my practice, which is something that I commonly do. Renuvion is a technology that helps tighten skin in ways that nothing else really can. And that really is an adjunct to liposuction, and I use it frequently after pregnancy on the abdomen, the flanks, and the lower back for patients. But for patients who have a belly with skin that has lots of stretch marks on it, Renuvion is typically not going to help those patients because the elastic fibers are just torn in their skin. But the options that are available go everywhere from liposuction and things that are easy, almost not non-surgical, but less invasive procedures for the abdomen, to mini tummy tucks, which is something that addresses more so the lower abdomen than the entire abdomen. But for patients who have that as their main issue, that's the way that we'll manage it. To patients who are having full tummy tucks and really need to remove skin and lots of skin from their belly, both upper and lower, while you repair those muscles that separate during pregnancy. So for a mommy makeover, or for the things that we're trying to treat after pregnancy, there's a whole host of things that we do for patients, and they all kind of get lumped into this category of, quote, mommy makeover. And all it really means is that we're doing something to adjust the breasts and adjust the abdomen to try to bring them back to body proportions that are more similar to the way people looked before pregnancy, or even better than that. So I hope this was helpful. Again, this is Dr. Newman. Feel free to contact me if you have questions, and just send me a message and I'm happy to answer it.